Dear friends, nowadays lots of people having varicose veins. You can see thread-like blue-green colored veins under your skin, either in single leg or both the legs, on your feet. Sometimes they may be as thick as almost half an inch diameter vessels. Varicose veins are serious because the basic problem is, whatever the reasons, these are not competent enough to push your blood back into the circulation. Because when you're standing and sitting with the gravity, most of our blood is slowly going into your legs and feet. But normally, our blood is pumped back because of a negative feedback mechanism. But what happens if the blood vessels are not competent enough, or the venous walls are not competent enough, or genetically some people have these problems? All this will lead to a kind of appearance of veins in your legs. What they cause? They cause a kind of a fatigue in the legs and swollen feet and swollen legs, and sometimes pain, sometimes burning, sometimes irritation. And the complications, of course, are very, very serious, forming a blood clot, deep vein thrombosis. Sometimes a person may have a venous ulcer, a non-healing ulcer, which doesn't heal at all. These are the complications. But not everybody go into complications very quickly. So if you find you have varicose veins, what should we do? Rule number one, your prolonged standing, prolonged sitting has to be reduced. Because when you stand more than 1-2 hours, like in some jobs like a traffic policeman or a security jobs, or people on a standing duties, a lot of occupations in factories, industrial workers, if they have already some amount of varicosity in their leg veins, they're likely to increase. So what should we do if you have such a job? Whenever there's a chance, you lie down. Put 2-3 pillows under your feet. The moment you come home, first lie down and put your feet high so that blood comes down. If you're a very fit person, you're doing exercises, you can do Sarvangasana, Viparita Karni. I don't want you to do Sirshasana because you have to be super fit. Or simple lying on bed and putting a small stool or some bed. Put your feet on it. Elevation of legs. This is number one, you should do on a regular basis. Number two, don't sit in front of a television for hours together. Don't sit in front of a YouTube. Whatever it is, you break your sitting. Or if you're working in office, sometimes you elevate your feet, put it on them, on the teepot or a small table. Thirdly is a medical management. So at least once in a year or two, you must get your ultrasonic study of the feet and the legs to see whether these veins are competent, or there is any clots are forming, or there is any problem in the flow, or is there any anatomical deformity. If not, you can use some kind of stockings. If you're not a complicated person, I like you to buy a football socks above knee. So you wear them when you're doing jobs involving standing or prolonged sitting, and you take them off when you're moving. While walking and working, there's no need. But definitely a static loading in the vessels, that means you're sitting quiet for a long time or standing quiet for a long time, the veins will be loaded with blood. This is important. How to wear stockings? There are different stockings. Stockings for DVT, stockings for just simple varicosity. Because the tension on the stockings varies. And depending on the size of the thigh and the legs, you can easily find out what size you should take. How to wear stockings? I have seen a lot of people wearing stockings, sitting and putting on the stockings and doing. It's a no meaning. So whenever you want to put on the socks or a stocking or a legging or any tights, you first lie down on your bed. 10 to 15 minutes you lie down. Simple common sense. You need to push this blood back into the circulation from your legs. And then wear your stockings. And then get down and do your work. Suppose you have to go to the toilet, you need to remove your stockings. Remove it, but before you want to really wear it again lie down on your bed for 10 to 15 minutes. Unload your circulation and then again put on the. And if you find any change in color, any ulcer, the swelling is going beyond your control, you must meet your doctor. Varicosity also applicable for some kind of a lymphedema. I am going to talk about lymphedema in my next video. Now you take care of your varicose veins. It's very important because their complications are all very serious. For a smaller varicose vein, don't go for an invasive therapies intervention, but your doctor is the best person who will help you. Doing a very gentle massage from down to upwards is also helpful because all these veins are superficial, they are not very deeper inside. I hope this information is helpful to you. All the best.